He's missing the point, which is get your data, get the diagnostics. When you start having symptoms of early stage disease, the slow flow, urgency, frequency, getting up in the middle of the night, those are all cues that you need to come in now to get your bladder health baseline, to get your data so you can find out when is the right time to do something about your bladder health. Most men don't ignore urinary symptoms. They simply explain them away. Why do men tolerate the urinary changes that they're experiencing for so long? Why does the slow decline feel like it's normal? And why does normalization delay action? Welcome to BPH 360, where bladder health matters. I'm Dr. Wayne Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions and take control. For education only, not medical advice. For your care, consult your doctor. If you remember from a previous episode about the cowboy, too many men are trying to be a tough cowboy, tough as nails, with grit and able to push through these symptoms of slow flow, urgency, frequency, getting up in the middle of the night to pass your urine or even leaking down your leg. We need to stop normalizing this and minimizing this and attributing it to just simply getting older as a process of just the aging that we all will expect to go through. We now in this modern era have solutions for you to deal with this as long as you come in at the right time for you, when we have options and we can still try and reverse some of the damage and dysfunction that your bladder may be suffering. Too many men suffer from what we call I'm fine syndrome. We've talked about it before. And it's where we're not willing to take off that armor of masculinity and we keep saying, I'm good enough, I'm fine. But in truth, we're just fearful that if we make ourselves vulnerable by saying that we are not okay with all of these symptoms, that what will happen next? What testing will happen? We need you to recognize that adapting and pushing through and living with these symptoms is not okay. It is not a sign of strength. It is a sign that you are ignoring your own health, your bladder health. And to be compassionate with the situation, we understand. Yes, it is understandable that you might be willing to live with it because the changes are so gradual and so insidious. But understand that underlying all of that, there can be very significant damage going on to your bladder. And if you wait too long to seek help and to get your data, some of that damage to your bladder can be permanent. And remember, you only get one bladder. It's not transplantable. You don't get to replace it. So please take the time to be aware of your symptoms. Listen to when your bladder's talking to you so you can seek help at the right time with your provider, your primary care provider, your urologist. So let's work together to really reframe how men are integrating with healthcare. For far too long, it's about how well can I tolerate my symptoms versus how do I find the right time to investigate my problems? Masculinity, that armor of masculinity, has been really getting in the way of how we access care as men and results in delayed care, often when it's too late and the bladder has suffered permanent damage. It is so important to reinforce that just because you think you're doing fine doesn't mean that your bladder is doing fine. For far too long, too many men have been waiting to reach a certain tipping point, after which they will then engage with healthcare and to find the data and the diagnostics needed to see what's going on with their prostate and their bladder. That tipping point is often when they're already in late-stage disease, when they are already starting to leak down their leg or they had to go to the emergency room like we talked about because they couldn't pee at all or pass their urine at all, which we call retention. And as a result, they had to have an emergency catheter placed up into their bladder. Or potentially waiting to the point that the bladder has now actually died. And now you have to have a catheter for the rest of your life. A really nice article that came out in 2022 was this one right here. Reaching a Tipping Point, a qualitative exploration of quality of life and the treatment decision-making in people living with benign prostatic hyperplasia. And it really shared some very common insights that we see all the time. And one of them is the following. We can see here a quote that they gathered from their research from a gentleman named Scott. "I don't think it's probably as bad as what other people have actually had. My father had something similar. I remember it got to the point where he had to have a catheter put in to deal with it. What I'm going through is nothing compared to what he had at all." And you see right there, Scott is normalizing, minimizing his symptoms, and because he hasn't gotten to the point of needing a catheter, that he's okay somehow. He's missing the point, which is get your data, get the diagnostics. When you start having symptoms of early stage disease, the slow flow, urgency, frequency, getting up in the middle of the night, those are all cues that you need to come in now to get your bladder health baseline, to get your data so you can find out when is the right time to do something about your bladder health. We don't want you to wait until, like Scott's father, it got to the point where he could not pee or pass his urine at all and needed a catheter. Please, this is a warning that listen to your bladder earlier on and get your data. And this quote kind of just highlights, once again, that for men, we put on that armor of masculinity, and you can see here that what delays care is this magic combination of men's health and their reluctance to kind of speak about it, and then the fact that it's related to, manhood and private parts. And this is from a man named Adam. You can see that men have this armor of masculinity. We don't want to talk about our private parts. We are fearful that if we make ourselves vulnerable and tell you that we're having symptoms and that it's bothering our lives, that you're going to start doing testing. And you're right. We need to have some testing, data diagnostics, because there's too much at stake. Your bladder health. You only have one of these organs. You can't transplant it. This is a very important organ. And if you don't take care of it, you could end up having a lifetime of leakage, a lifetime of using catheters. So please listen to your body and come in earlier to at least get some baseline data assessment so you know what's going on, so you can make the best decisions about your life. Quick pause. This is a serious moment. If your urine flow is very slow or you're having worsening urgency, leakage, or retention, that can be late-stage disease. At that point, supplements and pills may not be enough. On manvsprostate.com, there are simple tools to help you see where you may be on the bladder health stages and whether it's time not to wait and to go see your doctor and to ask, what about my bladder? Learn more at manvsprostate.com. Back to the episode. Let us all together stop asking questions like, can I live with this? Or how well can I push through my symptoms? And we really need to start asking, what is going on underneath these symptoms? What type of testing do I need? What type of data do I need to make a better decision about my life and about my bladder health? Remember, we are going to have the most number of options with which to help you when you come in earlier, in early stage disease, not when you're leaking down your leg or getting up 4 times at night to pass your urine or showing up in the emergency room or having a bladder that's actually starting to fail and die on you. Let's work together to shift from a perspective of tolerance, how well you can put up with your symptoms, to a perspective of strategy based on data. Remember, this is a problem, a mechanical problem, often for many men, as that prostate's getting tighter, causing a mechanical obstruction. And remember, to fix problems, we need your data to help you make the best choices about your prostate, about your bladder health, about your life. And just like you're running a business, for a healthy business, we look at the data of a profit and loss statements. And for a healthy body, let's do the same. For a healthy bladder, let's look at the data of your human physiology, of your bladder physiology, of how you are emptying and filling your bladder, and how is your bladder health. If you catch yourself or a friend or a family member saying some of these things or doing some of these things, these are red flags that they need to come in and seek help to get data about their bladders. And it's often when guys are saying, hey, it's no big deal. It's just part of getting older. It's just part of aging. Really dismissing things, normalizing things, minimizing their symptoms. Or if they say, it's something I can live with. Or if you find yourself beginning to plan your life around having to urinate and pass your urine, are you booking always that seat, the aisle seat in airplanes? Are you always having to use the bathroom before you go out for an errand? Or have you basically mapped out where all the toilets and bathrooms are in your neighborhood or in your life? Those are signs that you need to come in and get your data, get your bladder health baseline, so you can find out how to better intervene at the right time to protect your bladder and protect your quality of life. Some key takeaways: just because you have found a way to adapt to your symptoms, or you're telling yourself that, oh, I'm fine, that does not correlate to having a healthy bladder. It does not mean that you are not in trouble. Remember, when you delay care, when you come in too late, it can potentially cost you options to help you live the best version of your life, incontinence-free and catheter-free. And finally, be curious. Curiosity will protect the quality of your life and can protect your bladder. So be curious, just like when you're using your smartwatch or your smartphone to get your data about your heart health or your sleep health. Do the same thing about your bladder health. Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.